I am Dr. Malik. Today we'll talk about an important topic, transient ischemic attack, TIA, transient ischemic attack. Okay, see, why I wanted to talk about this topic today is early morning at about 4 o'clock. Today we got a patient, about 48-year-old man, who slept normally. He's a hypertensive. He was a hypertensive. He was on medication. He was a hypertensive. He was on medication. He's not a diabetic. He's a hypertensive. He slept in the night comfortably. At around 3 o'clock. At around 3 o'clock in the night, he wanted to go to toilet. He was trying to get up. He's unable to get up. His right hand is not working, very weak. Right leg is also very weak. So one-sided weakness. He wanted to talk. He's unable to talk. His speech is coming a slurred speech. He is unable to talk well. Slurring is there. And when he opened the eyes, tried to see, he could not see clearly. There is something like a sheet, a screen before every article. Whatever he sees, he's seeing it as some screen is stopping there is some screen in front. So his vision is also impaired. His eyesight is also impaired. He is unable to talk properly. Some slurred speech is there. There is right hand, one-sided paralysis, is unable to lift the hand, is unable to lift the legs suddenly. So he tried to cry, he is unable to. Suddenly his wife got up, who was adjacent to him. His wife got up. She asked what happened. He was trying to tell. She understood the situation. And they immediately took the patient to our hospital, brought the patient to our hospital emergency department. So I have seen him at exactly around 4:50, 4:30, early morning, 4 o'clock, 4:50, 4:30. Surprisingly, by the time he came to hospital, it took about half an hour to 45 minutes. He has totally recovered. After getting down from the ambulance, he started walking to the emergency department. He was walking. So within 1 hour, the patient totally recovered. But this half an hour to 1 hour was a severe mental trauma to the patient. He was crying, etc. So this is called transient ischemic attack. So usually, according to the book, we see so many cases like this. Almost once in a week we see such a condition. So what happens is, there is a temporary blockage. Of the brain, one part of the brain which is receiving blood supply. The blood vessel gets blocked for some time, and it relieves. So that area of the brain doesn't get blood supply for some time, and once the block is relieved in the artery which is supplying the blood supply which is going to the brain, that is relieved, immediately everything is restored. When you do a CT scan or when you do an MRI, in this patient, everything is normal, no damage done to the brain. It is very, very clean. So after this attack, see, it can last from 1 hour to 24 hours. Some patients get relief within no time, within minutes. Some patients within 1 hour. But some patients may recover within 1 day, within 24 hours. This is what is usually happens in this case. Some people recover within 1 day. Most of the people recover within 1 hour, or even minutes also. So this is an important condition. Why it is important? Because if this is neglected, probably 1 out of 10. Suppose 10 people suffer, 1 out of 12, usually 1 out of 12 they say. At least 1 out of 12 these patients, they may land in paralysis. In coming weeks. So this transient ischemic attack is supposed to be a danger symptom. It's a signal from the brain. It's a signal to the patient from the brain that the blood supply to the brain is hampered are going to be hampered, going to be getting low, and you may land in paralysis. That is an important thing you must remember. So in what exactly happens is there is sudden weakness of one side, one hand, one leg, one side of the body, sudden weakness, and the vision also gets impaired. You will see almost you cannot see properly, and your speech is also slurred. These are the sudden onset symptoms. Okay, and see, there will be nothing on CT or MRI. So usually this is because of a blood clot coming and obstructing the blood vessel which is supplying the blood to that area of the brain. By the blood clot can come from lower body, like deep veins in the leg, that can be a blood clot. Or number two, the blood clot can come from the heart. In one condition called infective endocarditis. This is one condition where there is infective endocarditis. Infective endocarditis is usually seen in valvular heart disease. Suppose the patient already has got, there are 4 valves in the heart. Previously also, the mitral valve, tricuspid valve, pulmonary valve, and aortic valve. Suppose the patient is already suffering from one valve disease, they are prone for infective endocarditis. So there can be an infection inside the heart which can lead to small vegetations along with blood clot. There can be small vegetations there which suddenly get released, and they can go to the brain and obstruct. Usually there are 2 main blood vessels. This is neck, this is brain. There are 2 main blood vessels. These are called carotid. So one is here, which are supplying blood to the brain. One is here and one is here, just beside the airway. There are 2. One carotid arteries. See, usually there may be some obstructions in this. So that a blood clot comes, gets stuck here. Or after going into the brain, they branch into multiple branches. This carotid artery gets multiple branches. In one of the branches also, the blood clot or the small vegetations can obstruct. This is the thing which happens. So usually, number 1, it can happen. The condition is like that. Suppose the heartbeat is irregular. Irregular heartbeat also can cause such things, such small clots. Number 2, infective endocarditis because of the valvular heart disease. Previously, the patient must have acute rheumatic heart disease. I already covered this topic in my previous talk. Acute rheumatic fever with carditis, where the heart gets involved. Acute rheumatic fever with heart involvement. In this, the valves get affected. So that in those patients also, you feel you will have such suddenly formed small vegetations or blood clots in the heart because of the valve is already damaged. So that can be the main reason. So mainly infective endocarditis or deep vein thrombosis somewhere in the lower leg or somewhere, some blood clot, it passes up and goes to the brain. From the heart, it goes to the brain and gets stuck up in the carotid or any small blood vessels inside. The carotid goes and branches into small blood vessels. So, and valvular heart disease, as I already told you. So, what are the tests we do in this condition? So, number 1, blood tests, lipids and sugar. If the cholesterol, triglycerides, if the LDL is high, if the cholesterol is high, in triglycerides high, there are chances of these things because carotid, these are the main blood vessels, carotid arteries. Already this cholesterol or triglycerides are forming plaques inside. They are getting deposited inside, it becomes thick. So there are chances that the lumen is getting narrower. The chances are high. Number 2, high sugars. High sugars are also dangerous. And one more thing is, if the blood is thick if the blood is thick, there is one condition called polycythemia, where all the blood cells increase and the hemoglobin is also very high, 16, 18 like that, 16 grams or 18 grams. If the blood is very thick, also this can happen. So, and one more thing is, see, there's a routine blood test done, CT-PT, for example, like INR, PT. These are to rule out how much time it takes for the blood to clot. CT-BT, clotting time, bleeding time, PT, INR, these are the tests which say that the blood is, how much time it takes for the blood to clot. These are because clot formation is also dangerous inside, not outside the body, inside. So the investigations we do is carotid Doppler. It is like an ultrasound, carotid Doppler. We do carotid Doppler to these carotid blood vessels to see any small occlusions are there. Any small occlusions are there in this carotid. This is carotid Doppler we do routinely to rule out any occlusions. And ECG 2D echo is a must. 2D echocardiogram of the heart to rule out those vegetations and clots formed by the infective endocarditis because of valvular heart disease, and ECG to rule out any irregularity in the heart. If the heart is irregular, also there are chances of clot formation. So what is the treatment? What is the treatment for this? Medical treatment is simply make the blood thinner, so that you use Clopid A, that is clopidogrel plus aspirin. Clopidogrel with aspirin. Usually we should 150 milligrams. So clopidogrel with aspirin is the drug of choice, and amiodarone is one tablet. Cardarone, it is available as Cardarone, which prevents irregular heart disease. The first tablet is blood thinner. The second tablet, amiodarone. Amiodarone is the tablet which prevents irregular heart, which prevents, if somebody has an irregular heart in ECG, it prevents irregular heart. Cardarone is the tablet. And the treatment, suppose you find some obstructions in the carotid artery. Here, these are the carotid arteries. Then, number one procedure is carotid endarterectomy. Carotid endarterectomy is the procedure done, surgical procedure. And number two, stenting with balloon. There is something like a balloon angioplasty. You put a stent and widen that particular stenosis. Suppose the area is very thin, the blood is not being allowed. You put through a stent, you are putting a balloon and just dilating that part. These are the things which are, but one thing most important to note is this condition predisposes to, it can predispose. So once you suffer a TIA, you are likely to go for paralysis. Be cautious. So stop the problem here. So very, very important.